homepage, on our DMG homepage. There you can find all further details concerning the concept behind and next events. So now we're excited to learn more about the various indications for aesthetic treatments and to discuss them furthermore. Before we start, I have just a few organizational hints. If you have technical issues during the webinar, please use the chat box. And if you have some content-related things, you can use the question and answer field, and we will answer all questions at the end of the session. You will have the possibility to download a certificate. Therefore, you will get an email tomorrow, a follow-up email with a link, and you can download the certificate. So that will be tomorrow. The session will be recorded. So if you ask questions during the webinar, please keep in mind that you can also do it anonymous if you don't want to have your name mentioned or to have it on the box on the screen. So you don't have to write down your name. Now I would like to pass the word to Professor Hilgert and to Susanne Effenberger, Dr. Susanne Effenberger. Enjoy the session. And we will meet us back at the end. Goodbye.
Yeah, also warm welcome from my side, from Hamburg. So good morning, good day, good evening, wherever you join us in the world. I'm really happy to see that so many people are with us this afternoon. And I'm really happy to spend this afternoon with you, but most of all with Leandro. He is a professor at the University of Brasilia, but much more than this, he's a very good friend and certainly a pioneer in particular when it comes to aesthetic dentistry and also aesthetic indications for resin infiltration. And this is also a major part of his presentation today. And I know his professional skills because he's also my dentist. So I'm really glad to see in his cases that I certainly made a good choice letting him solve my problems. And and I think you can expect really a very interesting journey into aesthetic interventions from a non-interventional to a micro-interventional to an interventional level. And don't forget, there's also a spin-off on next Monday where we talk about veneering techniques. And Leandro, please share your knowledge with us. And I'm really curious about what you have to share.
So thank you so much, Susanne, for this very nice introduction. Thank you so much for the invitation to be with you in this morning, afternoon, evening. So you're welcome, my colleague from all over the world, for this next minutes in which we're going to talk a little bit on how to improve smile aesthetics. Today, we're going to talk a little bit more on, I would say, less invasive techniques, on micro-invasive techniques, bleaching, resin infiltration, a little bit on composite restorations. And for next week, we're going to talk a little bit with ceramics together with my good friend, Professor Monte Alto. I'm just going to introduce a little bit here. As Susanne said, I'm talking to you from Brasilia. Brasilia is the capital of Brazil, just in the middle here of Brazil. It's a planned city that was built from scratch in the end of the 50s. So you can see how from this crazy scratch from the from Lucio Costa, we have now the capital of Brazil. And I'm talking to you right from here, from my home today. Here is the University of Brasilia, where I work. And Brasilia is a very nice place to visit. I recommend that visit to all of you. We have lots of architectural famous buildings here from the Brazilian architect Oscar Niemeyer, and you can see them also from the very nice case planning that they had. We have these buildings here in Brazil as the National Congress, the Cathedral of Brasilia, the Supreme Court, the presidential palace here of the Planalto. But I know I'll let you come to Brasilia to know all these things. Today, our topic is dentistry, and we're going to start a little bit with our planning. First thing, I always show in many of my lectures that to deal with the intervention of levels of intervention in dentistry is the tooth that spiral. I want you to look at this slide and think, if you haven't seen this patient before during your dental school or now in your practice, patients that start with small restorations, and these small restorations, they become larger restorations, and every time they get more complicated restorations, and we have more destruction of the crown. And for patients that are young, we are seeing the need of extracting a tooth because it has suffered from the tooth that spiral or for the restorative cycle. So this is something that a yellow light comes up when we see that the only restorative dentistry actually does not guarantee for our patient the motto of the minimum intervention dentistry philosophy, that is healthy and functional teeth for life. Something needs to be changed. And that's what the minimal intervention dentistry philosophy points out for us, that we need to change this only, I'll say, mechanicist or a technical way of seeing dentistry and deal a little bit more with the etiological factors that raise to our patients the appearance of caries lesions, non-caries lesions. We need to tackle actually the etiological factors to maintain good health. Restorations, are they needed? Yes, sometimes they're much needed in our treatment protocols, but restorations, they cannot be as much invasive so that they compromise tooth's longevity. If I need to choose what I want to last longer, the tooth reminiscent or the restoration, I will always look for treatment procedures that preserve a little bit more the tooth. So it means that I can treat my patients once again in the future. And we can extend this philosophy to everything in our dental practice, in our daily work in dentistry. And I really love this paper from three great names of restorative dentistry in the world, Professor Nick Opdam, Roland Frankenberger, and Pascal Magnier. And in this paper that deals a lot with choice of restorative protocols and restorative materials for the posterior dentition, the part I like the most is this one, in which they show five topics, 5 rules that we should follow in our daily practice. We could speak here hours and hours on the part of control of dental caries and control of non-caries lesions, on how to postpone the first restoration as long as possible. We could talk hours and hours on selective removal of caries tissue. That is a very nice way to remove what we need to place a restoration, but maintaining pulp vitality as a main objective. We can talk hours and hours on adhesion and bonding protocols and how to seal and how to place restorations that have more longevity and thus require less substitution, making slower the transition of phases on that spiral of the death of the tooth. But today, since we don't have that much time today, we're going to talk a little bit on this 4th topic, on how to reduce the amount of tooth substance loss by using minimally invasive preparations and treatment techniques, especially on how to apply some minimum intervention concepts on static dentistry. I know we all love static dentistry. That's why we're here. That's why we chose this part of the profession, operative dentist or prosthodontist. And this is what we're talking here. And knowing that every time that we place restorations or we perform a treatment on our patients, we need to think on how to maintain it successfully on the long run. So we're going to talk about statics, but we're going to do statics thinking on everything that my patient is gaining, and also thinking in everything that my patient can lose in terms of tooth longevity if I do not perform something less invasive that has a correct indication, that to preserve tooth substance as much as we can. Never forget that inside the word aesthetics, we need to observe the word ethics and just do in our patients what we would do in our own mouth or in the mouth of the people that we really love. So I have here 4 pictures with 4 different problems that those patients presented to me here at our clinic at the university. The first one on your upper left corner, a patient that had beautiful teeth, that natural teeth, and she just want whiter teeth. And what going to do when the problem of my patient demands a correction is just color? I don't have anything to change here in terms of form, especially because she likes her smile like this. Upper right corner, a patient that had a trauma, and this tooth number 11 here got a little bit darkened, and she doesn't have a pulp chamber and a pulp canal because she had a calcification of the pulp here, and she doesn't have anything in this tooth. She doesn't have an endo, and she wants, of course, a tooth that looks like the other one. She needs to correct the shade here, the color. Am I going to place a crown? Am I going to do a veneer? Should I try something less invasive? This is what I want to discuss a little bit with you. Sometimes it's not just the teeth are darkened, but the teeth have white opacities, diffuse white opacities, like in fluorosis cases, some white opacities due to white spot lesions from caries, some demarcated white opacities like we have here from some other kind of hypomineralizations like MIH, for example, and some patients that need to correct the shape, the form of the teeth. Young patients, how should we deal with those cases? That's what we're going to discuss in those next minutes that we have together this morning. For me here in Brazil, it's 11:15 a.m. And the first topic is going to be tooth bleaching. So this is something that we study a lot here. We do a lot. Brazil is a country that people really sensitivity. This is a patient that probably will suffer from tooth bleaching sensitivity. The mechanisms of pain are different, okay, but it's everything due to a permeability of the tooth structure. And I need to first treat this dentin hypersensitivity and control it, so I can go with a very mild technique of bleaching on those patients. Can I use desensitizers? Yes, there are some researches that suggest that we can reduce nerve excitability, especially using desensitizers prior to the tooth bleaching procedure based on potassium nitrate and sodium fluoride. But I'll need to say that the evidence of the efficacy of such procedure is debatable, clinically debatable. You can see here a very recent, has like 2 weeks that has been published, systematic review on that. And you can see that it favors the application of desensitizers based on potassium nitrate just a little bit. So clinically, we might discuss how important this procedure is. And one thing that now we know, maybe you all know all over the world, some years ago, we would say to our patients, please do not drink red wine. Do not eat something with ketchup. Please no coffee while you're bleaching. And this was something that was very complicated. If you tell me, please do not drink coffee, I probably won't survive the 2 weeks or 3 weeks of a whitening procedure. And now we know from many clinical trials that probably we should not worry that much, or we should not worry at all with the ingestion of pigments during a tooth bleaching procedure. Even pigments like Coca-Cola, they have been shown to not influence the bleaching. But one thing is interesting. Since patients that drink a lot of Coke during bleaching, and Coke is very acid, this acid Coca-Cola, it probably increases the diffusion of peroxide through enamel. And patients that drink a lot of Coke, they suffer more of tooth bleaching sensitivity than the control group that avoided drinking a lot of Coke. Very interesting. And actually, it explains everything that we have seen until now. Really quick, just to open your mind to a procedure that I like a lot, I'd just like to show you a little bit of non-vital tooth bleaching, because I think here we have a procedure that can save a lot of tooth structure. For all those cases that you're seeing in my screen here, all those cases came to us at the university with the indication of a crown to correct this color problem that the patients had. But in all those cases, we had lots of enamel, and the tooth structure was well preserved. So using different techniques, we won't have time to discuss them all, using different techniques of non-vital tooth bleaching, we bleached those teeth. And in all cases, we had a very nice success without sacrificing that much tooth structure, with that much enamel, that much dentin. We published a chapter on that. Unfortunately, it's only in Portuguese. So many of the Brazilian friends here that are watching us, they already know this book here. In a very, I would say, challenging case, this patient came to us with 3 teeth that were very, very dark. And my PhD student, she's an endodontist. She retreated the endo of these teeth, and then we performed the inside-outside bleaching technique. Is one that I like a lot. So here we're measuring the clinical crown of the tooth and removing the endodontic material and the previous restoration, and doing this cervical barrier is the most important part that we need to do always if you're doing a non-vital bleach or an internal bleaching, as some like to call. Here we're doing an in-office session, the first session with 35% hydrogen peroxide gel, and we produce for this patient an at-home bleaching tray. And we taught the patient how to apply the gel outside the teeth into the tray, and inside the teeth into the chambers that were maintained open but sealed in the cervical area before. And the patient used an at-home gel for, in this case, 3 weeks. And from that situation that she presented to us, now she is in this kind of shade here, and now we just need to do some I would say details in the incisal area. So if you look here, I always ask people, please pay attention here in this lateral here that is much darker than the C4 shade tab. That is the darkest one that we have. And look what happened there with 3 weeks. And now we don't need 3 crowns anymore. And we did a very micro-invasive treatment, and we encountered the demand. We solved the problem. The demands of the patients were solved. One very common question is, but if I do non-vital bleaching, don't I have the very high risk of a cervical resorption? If you go to the literature, to the modern literature, with modern procedures, you're going to see that in recent times, we do not observe that much. So, see, many cases, many clinical studies with 0% cervical resorption, and it's even the topic of a very nice paper published in the British Dental Journal last year, that based on current evidence, the risk of external cervical resorption following internal bleaching with modern protocols is likely much lower than the previously reported. So pay attention in this technique. For some cases, it might help you. And today we have many clinical studies, lots of information and lots of reports, some of them with a very long-term follow-up, like these ones from our colleagues from Italy, showing that non-vital bleaching may be a very nice solution for those cases in which you have tooth structure preserved, and that you do not need to crown or veneer those teeth anyway because of functional or needs in changing the form of those teeth. All right. So on bleaching, this is what I would like to say. Individualize, think about bleaching as a very, I say, minimally invasive option to alter, to change color in your clinical cases. I think here is a very nice example of aesthetics with minimal intervention. So that's what I had on bleaching. Suzanne, do you have any questions on this part of our talk?
Yeah, well, thank you very much for summarizing